Mhm. Okay. Well, so we'll start speaking about explaining and reassuring. So this is the second part of the conversation about this that we started last class. And first, I would like you to focus on the slide, which is here, the first slide. And as you see, there are some comments on homework that you have done. And as you remember, the task was to use the past or present tense and active voice or passive voice, depending on the meaning of the sentence. I mean, the task was to use the verbs which are given in brackets in the correct form instead of gaps. So let us just one more time look at the sentences because there were some mistakes. I hope that you didn't just pay attention to this, but it's important. Manish, will you read the first sentence? Please.
Yes, ma'am. The park gates will be locked at 6:30 p.m. every evening.
Okay, so will be locked is okay, but you use the future tense. If it is present simple, can you just use the verb in the present simple tense?
He's locked at.
Yes, but gates is plural form, right?
Are locked.
Are locked. Yes, are locked. Okay, the second sentence, Pradeep.
Yes,
Mm-hmm.
why did she resign from her job?
Mm-hmm. Yes, right. So there were the second and the third sentences are very similar, but here we should use different voices. Here, active voice. The next sentence is for Hita, please. About Ben.
Yes, ma'am.
Mhm.
Yes, ma'am. Why was Ben fired from his job? Did he do something wrong?
Yes, here we use the passive voice because he didn't do it himself. He was fired by his supervisor, for example. The next sentence is for Bhuvanesh, please.
Yes, ma'am. Where does these pictures took in London dash then somebody else?
Mm-hmm. In the first case, in the first part, we used the passive voice. Where were these pictures taken?
Where were these pictures?
And in the last sentence, did you take
Yes.
this active voice? You're right.
Did.
Okay, thank you. Now, Suhita, please.
The boat hit the rock and sank quickly. Fortunately, everybody was rescued.
Was rescued. Good. Mm-hmm. So the next is for Afnan.
Here's option, ma'am.
Mm-hmm. So Afnan. Mm-hmm. Now, Khadija, are you here?
Yes, ma'am.
So about
When I was on holiday, my camera was stolen from my house room.
Yes, was stolen. This is the passive voice because it was done by somebody, so the person we don't know about. Okay, and the last sentence here is for Musharifuddin.
Yes, ma'am. The letter was sent a week ago and it arrived yesterday.
So we can use the arrive in active voice when we speak about letter, but send should be used in the passive voice because it was sent by a human being anyway. Okay, so just we should be very careful while using the passive voice. And that was one of the tasks that you've just submitted. And the second task was the essay. I asked you to write the essay. I liked your essay very much. And the information that you give in these essays are very important for me and for my colleagues. It's good that you've done the research about our university, and you've just found the information about how large the university is and which place it takes in the ranking, and how many students and what kind of teachers work, professors work for this university. I think it is useful. It was useful for you just to search for this information, and I would thank you for the feedback that you gave in your essay about the university, and you compared the system of education in your country and in Kazakhstan. So thank you very much for this. Well, and we go on to the next slide, and here there is a picture which we discussed at our previous class. This is the doctor who is talking to his patient. Do you remember the doctor's name? No one remembers. His name is Dr. Quinn. And now we are going to speak about reassuring. Reassure means to say or do something to remove the fears, to say to a patient. And so in the conversation that the doctor, in the conversation of the doctor with his patient, the doctor uses two adjectives to help make the procedure less frightening and thus reassure the patient. So the example of such sentences are given. So the tube will have a tiny camera, or it's a routine procedure. So the doctor emphasizes that there's nothing to be scared about, right? And so these kind of adjectives help him to sound more reassuring. And now let us have a look at the sentences on this slide. And well, so the task here to read the sentences and think which sentences are not very reassuring and why. Well, let us listen to so Mayuka, please. The first sentence is for you.
Yes, ma'am. It's a very simple procedure. I think it's reassuring, ma'am.
So why?
Because he's using words like simple.
Okay, great.
Like simple and common.
Okay, yes. Rina, the next, please.
Yes, ma'am. We are just going to take some fluid from your backbone. It is not reassuring, ma'am.
Not reassuring or reassuring? You see, the doctor says just we are going to
reassuring, ma'am. Just
reassuring.
going to.
Yeah, and you see that there is the backbone. The illustration is given here to the right. What is another word for backbone?
Vertebral column.
Okay, good. Well, now let us listen to Pargavi, please.
Yes, ma'am.
You'll just feel slightly sore after the test. It's reassuring, ma'am.
Why?
Just feel slightly.
The adjective is used and the word just. Well, the next is for Vidya, please.
Yes, ma'am. All you'll feel is a tiny scratch, nothing more. It is reassuring, ma'am.
Because of what?
Because he uses nothing more.
Yes, tiny and nothing more. Right. Okay. So the next is for Lahari.
Yes, ma'am.
Mhm.
It will take 10 minutes.
Is the sentence reassuring?
Yes, ma'am. No, ma'am.
No. And how can we make it more reassuring? So here are in the previous sentences,
It just takes 10 minutes.
the just is used, going to is used, and something else. Yes, who can help?
It just takes 10 minutes.
Will just take 10 minutes.
Okay. Or it won't take long, right?
Oh,
Okay, so the next sentence, number 6, please, Manish, read it.
It only takes a few minutes. Yes, ma'am, it's reassuring.
Okay, so only and a few. Well, Pradeep, please.
It's not a pleasant procedure, ma'am.
Is this sentence reassuring?
I think no, ma'am.
So how can we change it just to sound more reassuring? Yes? Who can help us?
it's a pleasant procedure.
Really? To speak about gastroscopy, I don't think it's pleasant. So we shouldn't lie to a patient, but just say something encouraging. So what do you suggest? Any ideas? It's not a pleasant procedure.
It's not a pleasant procedure. It's a regular process. Procedure, regular process.
No ideas. Okay, I don't know. You are a future doctor. You doctors, you should just think about like how to sound not so frightening to a patient.
I think 90% of the doctor, they lie to the patients
So, but
to
anyway,
make them
very
feel happy.
straightforward. Like,
Yes.
we'll do something. We'll give you some sedative just to feel relaxed, like maybe like this.
Yes.
Okay, and the last one is for Rohita.
Yes, ma'am. You will hardly feel anything. It is not a reassuring, ma'am.
It is reassuring. You'll hardly feel anything. This is the maybe the sentence which can be used instead of number 7, right? So as you say, doctors always lie to their patients. Okay, now let's go to the next slide, and one more way of how to sound more reassuring is to emphasize some structures. So here we are going to listen to several statements, 8 statements, and write the word the doctor emphasizes or stresses in each sentence. Okay, now just be ready to to write these words, and also you should say if you can hear or not.
Listening 3. 1.
Can you hear?
Yes, ma'am.
Okay, now let's start.
Listening 3. 1.
It's a very simple procedure.
2.
We're just going to take some fluid from your backbone.
3.
You'll just feel slightly sore after the test.
4.
All you'll feel is a tiny scratch, nothing more.
5.
It'll take 10 minutes.
6.
It only takes a few minutes.
7.
It's not a pleasant procedure.
8.
You'll hardly feel anything.
Well, so in the first sentence, which word is stressed?
Very
Very,
simple.
I guess.
Very simple.
Simple. Simple. In sentence number 2, what is stressed?
Just going.
Just going.
Just going. In number 3.
Feels slightly.
Feels like.
Slightly sore. In sentence number 4.
Tiny
scratch.
Tiny scratch. Okay. In sentence number 5.
10 minutes.
10 minutes.
10
minutes. In number 6.
Few minutes.
Few minutes.
Few.
Only.
Take.
Yes. In sentence number 7.
Pleasant.
And in number 8.
Hardly
Hardly anything. Yes. You see, this is done just to emphasize just the procedure is not so dangerous. And in this sentence number 7, it's not a pleasant procedure. She emphasizes the word pleasant, and so the patient hears the word pleasant and changes, I hope that he changes his attitude to this procedure. It is done just to reassure the patient and to make him less stressed. Okay, and
Listening 3.
Here there is also information about one way of the doctor can sound. One way of explaining procedure to a patient is the use of the future structure be going to. So before the doctors perform the procedure, they need to explain procedure to a patient in order to obtain patient consent. You remember about this. And the future with the be going to is usually used to explain the procedure even when the patient hasn't yet agreed to the procedure or given consent. So anyway, with the doctor says, we are going to, I'm going to. The going to, which is used because is the clearest and most direct way to give an explanation. When the procedure is fully explained, the patient can give informed consent. So the consent that he is aware of the procedure and he knows all the details about this. And the example is given here on this slide. We are going to give you a mild sedative. We are going to. And one more structure that is used in the reassuring, in order to reassure the patient, is in addition to using the be going to future, doctors often use fixed expressions with what to explain procedures. And the examples are given here, both be going to and what. What we are going to do is take a tiny sample from your scalp. What happens then is we are going to give you a mild sedative. What happens next is that we insert the needle. What we need to do after that is stitch the wound. So these are the useful structures, and now let us have a look at the sentences here on this slide, and the task is to change the explanations with the help of to be going to, and we should also simplify the medical terms. And where indicated, we should use an expression with what. Well, let us listen to Vanesh.
Yes,
for the first.
A sample is taken from the ball. What is going to take out from the ball?
We don't need to use what here. We need to use go into.
A sample is going to be taken from the ball.
And yes, it's possible, but I think we can also use active voice. If we use active voice structure, how does this sentence sound? We are
A sample is
not sample, but I'm or we are going to.
We are going to take out a sample from the ball.
Yes. Okay. The next is for Sohita. Sohita,
Yes,
please.
ma'am. Next, the end of the intestines is attached to an opening on the abdomen. What we are going to do next is
to attach.
Is to attach the end of intestines to an opening on the stomach.
Exactly. Good. Okay, so the next is for Afnan. He's not here. And Khadija.
Yes, ma'am. A sample is taken from the cervix. A sample will be going is taken from the cervix.
Use the active voice, please.
A sample is.
No, we start with not a sample. We start with the we or I.
We are going to take out the sample from the cervix.
Okay, so Sharif is. Sharif, are you here?
Yes, ma'am.
Okay.
After that, a tube is passed through the urethra. What we have to do after that is to pass a tube through the urethra.
Exactly. Good. Well, then, Mayuka, please.
What happens next is then we are going to remove the gland from the axilla.
Yes. Okay. Then, Rina.
Ma'am, next a sample is removed from the lung. What we are going to remove a sample from the lungs.
What we are going to do next is to remove
sample from
the lung.
Remove from the lungs.
Okay. Bhargavi, please.
Yes, ma'am. What we are going to do after that is to pass down a tube pass down the tube that prostate into the bladder.
Pass down the tube. No. To pass the tube down past the prostate, right?
Yes.
Okay. Well, Vidya, please.
A dye is then injected into the pancreatic and bile ducts to visualize them. What is going to be happen? What happened?
What is going to happen, or what we are going to do is
dye is injected into the pancreatic and bile ducts to visualize them.
Or we can use the active voice. Please use the active voice.
We are going to inject into the pancreatic and bile ducts to visualize them.
Yes, what we are going to do is to inject the dye into the pancreatic and bile ducts to visualize them. Okay. And the next sentence is for Lahari. Lahari. Hello. Is Lahari here? No.
Yes, ma'am.
Okay. So number 9, please.
The muzzle is repaired with a mesh. The muzzle is going to be repaired with a mesh.
You use the active voice, please.
Okay, ma'am.
Who is going to repair? We are going. Yes, who can help us?
We are going to repair the muscle.
With a mesh.
Okay, we're going to repair the muscle with a mesh. So the mesh is given here. It's shown in the picture. Okay. So this is the way we can use the to be going to phrase and what structure. And there are some more ways of sounding more reassuring. Sometimes you may have to give a patient a brief explanation of a procedure. So let us explain the conditions using the expressions. A condition where, an illness where, a procedure where, a device which you used to. So it means that you should explain using these words which or where. The example here is about anemia, which says not enough pigment in the blood. And our explanation should sound like, it is a condition where you do not have enough of a special pigment or coloring in your blood. So let us look at the conditions and procedures which are given here and from 1 to 6, and let us think of how to explain, to give a brief explanation to the patient. So Manish, what do you think of the first one?
Appendicitis, inflamed remove. Appendicitis is an illness where the appendix, where we remove the inflamed appendix.
Yes. You're right. Where we remove an
inflamed appendix.
Okay, great. Well, the second one is for Pradeep.
Alzheimer's disease, one memory loss and mood changes are not known. It is a condition. This is like where memory loss, mood changes.
Yes, and
it's a disease condition like memory loss, mood changes.
And the cause of this illness is not
cause of this known. Cause of sickness is known.
Is not known. Okay. Well, Rohita, please.
Yes, ma'am. Hemorrhoidectomy means it is spelled tight, cut out. It is surgery to remove hemorrhoids, ma'am.
To remove a piles tire.
Yes,
Okay. Well, the next is for Vanesh.
Yes, ma'am. Diverticulitis. It's a condition where weak point of gut is infected and inflammation, pain of diarrhea, constipation.
what is it? Is it an illness or condition or procedure?
It's a condition.
Condition.
Yeah.
Condition where
weak points of gut infected and inflamed.
are infected and
Yes.
inflamed. Okay, so you know better anyway. So the next one is for Sohita.
Yes, ma'am. Sigmoidoscopy. It's a procedure where we look at the colon sample.
Okay.
Or the device.
Device?
Scopy is a procedure.
No, it's a procedure because it's not scope, it's copy. Okay. And the next one is for Afnan. No, for Khadija.
Yes, ma'am. Anesthesia generally put you to sleep, come around. It's like they give you a sensation so that you don't know what is going on to put you to sleep.
So this is a procedure, right?
Yes.
Procedure where a patient is
Become unconscious.
I see. Okay, good. Well, and so if we move to the next slide, there is information about a leaflet about gastroscopy. So you can see the doctor is explaining to a patient this procedure, and here we can see the headings given here, the headings from the leaflet, which gives information about gastroscopy. If we look only at the headings, let us decide what information each part of the text under this heading contains. So let us listen to Musharif. The first heading is for you.
What preparation do I need to do?
What is this part of the leaflet about?
It's about what must be done before gastroscopy is done.
Okay. Like what?
I don't know, ma'am, means not to eat food before operation. I don't know.
Okay, so good. What about the next heading? Mayuka, please.
What can I expect after a gastroscopy? Like, is it okay to eat or drink right after the gastroscopy?
Okay, good. Now, Rina, please. The next one.
Yes.
Next heading.
Is gastroscopy reliable? Reliable means yes, I think yes, ma'am.
So what is this part of the leaflet about? Reliable, that we can rely on the results of the procedure.
Will the results will be good after
operation?
After the procedure is the previous heading, and this is about the results. Do we can we trust the results? Yes, and how reliable the results are. Okay. Well, and the last one is for Pargavi, please.
Are there any side effects or complications from having gastroscopy? So will there be any side effects if the patient undergoes gastroscopy, such as could be anything.
Okay.
Like it could be normal
Like
side effect.
getting infection or
Yeah.
like this.
You already know about these complications. Okay, now we are starting reading this leaflet paragraph by paragraph, and the first one, what preparation do I need to do? Let us listen to Vidya, please. Read it.
Yes, ma'am. What preparation do I need to do? The hospital department will usually give you instructions before your test. These commonly include: don't eat for 4 to 6 hours before the test. The stomach needs to be empty. Small sips of water may be allowed up to 2 hours before the test. If you have a sedative, have somebody accompany you home. If you are taking any other medication, tell your doctor. It may need to be stopped before the test.
Okay, actually, this information is familiar to us because we listened to some information from the doctor who described the necessary just steps, the steps before gastroscopy is done. Okay, so and the next piece of information is for Lahari, please. Lahari. Hello. Okay, Manish, read it, please.
Yes, ma'am. What can I expect after gastroscopy? Most people are ready to go home after resting for half an hour or so. If you have had a sedative, you may take a bit longer to be ready to go home. The sedative will normally make you feel quite pleasant and relaxed. However, you should not drive, operate machinery, or drink alcohol for 24 hours. After having the sedative, you will need somebody to accompany you home and to stay with you for 24 hours until the effects have fully worn off. Most people are able to resume normal activities after 24 hours.
Okay, thank you. So it looks like we are short of time, so we've read two paragraphs from the leaflet, and I think